The second one are ganglion blockers. These agents blocks the nicotinic receptors of both parasympathetic and sympathetic autonomic ganglia. Thus, these drugs block the entire output of the autonomic nervous system at the nicotinic receptor. Except for nicotine. Nicotine depolarizes autonomic ganglia, resulting first in stimulation and then in paralysis of all ganglia. The stimulatory effects are complex and result from increased release of neurotransmitters, due to effects on both sympathetic and parasympathetic ganglia. These drugs show no selectivity toward the parasympathetic or sympathetic ganglia and are not effective as neuromuscular antagonists. Thus, these drugs block the entire output of the autonomic nervous system at the nicotinic receptor. Except for nicotine, the other drugs mentioned in this category are non-depolarizing, that is, they are competitive antagonists. The responses of the non-depolarizing blockers are complex and mostly unpredictable. Therefore, ganglionic blockade is rarely used therapeutically, but often serves as a tool in experimental pharmacology. Neuromuscular blocking agents. These agents block cholinergic transmission between motor nerve endings and the nicotinic receptors on skeletal muscle. Neuromuscular blockers are clinically useful to facilitate rapid intubation when needed due to respiratory failure. During surgery, they are used to facilitate endotracheal intubation and provide complete muscle relaxation at lower anesthetic doses. This increases the safety of anesthesia by allowing patients to recover quickly and completely. They possess some chemical similarities to acetylcholine and act either as non-depolarizing or as depolarizing at the receptors on the end plate of the neuromuscular junction. And so these drugs are divided as depolarizing agents and non-depolarizing agents. Cisatraculaneum, mivacurium, pancuronium. Rocuronium and vecuronium are non-depolarizing agents while succinylcholine is a depolarizing agent only. They are used to relax the muscles to help keep your body still during surgery. And also relaxes your throat so a breathing tube can be more easily inserted before the surgery. How are neuromuscular blocking agents administered? All neuromuscular blockers are injected intravenously or occasionally intramuscularly. These agents penetrate membranes very poorly and do not enter cells or cross the blood-brain barrier. This is why the administration of neuromuscular blocking agents is most effective via these routes. Now, what is the difference between depolarizing blockers and non-depolarizing blockers? Mechanism of action of non-depolarizing blockers. At low doses, neuromuscular blockers competitively block acetylcholine at the nicotinic receptors without stimulating it, thus preventing depolarization of the muscle cell membrane and inhibiting muscular contraction. Their competitive action can be overcome by administration of cholinesterase inhibitors, such as neostigmine and idrophonium, which increase the concentration of acetylcholine in the neuromuscular junction. Clinicians employ this strategy to shorten the duration of neuromuscular blockade. In addition, at low doses the muscle responds to direct electrical stimulation from a peripheral nerve stimulator to varying degrees, allowing for monitoring of the extent of neuromuscular blockade. While at high doses non-depolarizing agents can block the ion channels of the motor end plate. This leads to further weakening of neuromuscular transmission, reducing the ability of cholinesterase inhibitors to reverse the actions of the non-depolarizing blockers. With complete blockade, the muscle does not respond to direct electrical stimulation. And as for mechanism of action of depolarizing agents. Depolarizing agent attaches to the nicotinic receptor and acts like acetylcholine to depolarize the junction. Unlike acetylcholine, which is instantly destroyed by acetylcholinesterase, the depolarizing agent persists at high concentrations in the synaptic cleft, remaining attached to the receptor for a longer time and providing sustained depolarization of the muscle cell. The depolarizing agent first causes opening of the sodium channel associated with nicotinic receptors, which results in depolarization of the receptor. This leads to a transient twitching of the muscle. Continued binding of the depolarizing agent renders the receptor incapable of transmitting further impulses. With time, continuous depolarization gives way to gradual repolarization as the sodium channel closes or is blocked. This causes a resistance to depolarization and flaccid paralysis. And so guys, I want you to know this big point here that, depolarizing muscle relaxants act as acetylcholine receptor agonists, whereas non-depolarizing muscle relaxants function as competitive antagonists. Anticholinergic effects. Guys, I want you to remember anticholinergic effects so that you won't be tricked with questions. There is a simple mnemonic to remember anticholinergic effects, that is, can't pee, can't see, can't shit, can't spit are the result of anticholinergics. Or you can use this, hot as a hair, which means fever. Red as a beet, which means flushed skin. Blind as a bat, asthmatriasis. Dry as a bone, which refer to dry mouth, dry eyes and decreased sweating. Full as a flask, which means urinary retention. If anticholinergic drugs are prescribed, review these points with the patient and his caregivers. Take the drug as prescribed, don't take other drugs with the anticholinergic unless prescribed. Avoid hazardous tasks if dizziness, drowsiness, or blurred vision occurs. The drug may increase sensitivity to high temperatures, resulting in dizziness. Avoid alcohol because it may have additive central nervous system effects. Drink plenty of fluids and eat a high-fiber diet to prevent constipation, since constipation is a common side effect of anticholinergic drugs. Notify the prescriber promptly if confusion, rapid or pounding heartbeat, dry mouth, blurred vision, rash, eye pain, a significant change in urine volume, pain on urination, or difficulty urinating occur. And also women should report planned or known pregnancy. Thank you guys, don't forget to subscribe, hit the like button and turn on the notification for more incoming videos.